guys, and welcome back to the Nurse Nook. My name is Alexis Nicole and I'm a registered nurse. If you guys are new to the channel, welcome to the Nurse Nook. I make videos about lifestyle, nursing, and just how to navigate the fields of nursing and giving you guys tips and motivations on making it through. So in today's video, I'm going to be talking about common mistakes nurses make and how to avoid them. So a lot of these mistakes a lot of people have made in the field of nursing, especially new nurses, and so I'm going to try to shed some light on it. If it helps at least one person avoid one of these mistakes, I am happy. This video is sponsored by Modern Fertility. Basically what it is, it's an at-home test you take. You prick your little finger, you fill the little card, the little blood sample card with the blood from your finger poke, you send it off to the lab, and it gives you really detailed insight into your fertility health. Whether you are trying to start a family now or in 10 years, 15 years, whatever it is, it's never too late to get a jump start on your fertility health. It just gives you a lot of great insight and helps you take control over family planning when you're ready, when you want it, and how you can best prepare your body for it. The kit also comes with things like pregnancy tests and ovulation kits. The ovulation kits I think are really, really great. It's not only pertinent if you're trying to get pregnant now, I think it's really great for women that are trying to avoid getting pregnant because the ovulation test really tells you the days of the month that you are most fertile. So if you're interested in avoiding said days because you're not ready for that stage of your life yet, it's a really, really great tool. They will be linked down below. Like I said, this is a great resource. I'm all about women's health, and this is something that I have used. I think it's great. So I'm recommending it to you guys. Okay, so let's jump into the video. Common mistakes that nurses make. The first one that I'm gonna get into, because I feel like this is one of the most important ones on this list, never get too comfortable. So this is something that you see, or that I see in nurses that have been nurses for a few years. You kind of just get into routine, especially if you've been in a specialty for a while. I haven't really experienced this yet because I have switched specialties pretty much every single year. And so I feel like I haven't even gotten the opportunity to get comfortable because I'm always learning new stuff because I'm always on a new unit. I remember one time I was talking to a doctor I used to work with in the ER, and he was asking me how I was adjusting to being a nurse, and I was just telling him that I am really nervous a lot of times. And he told me that's great. You always want to have some type of healthy anxiety behind you because that's how you keep your patients safe. Once you start getting too comfortable, you start making silly mistakes because you almost go on like a autopilot, and a lot of times you don't catch things because you're so used to doing things routinely, and so you're not having that like sharp eye that you normally have whenever you're nervous or doing something for the first time. So I always say never get too comfortable. And not only do I say that because you might get too routine and getting used to things, but also I say not to get too comfortable because you should always be learning something new. Nursing is constantly changing. Every day I am learning something new. I still consider myself fairly new to the NICU. I've been here for almost 10 months now, and every day I'm learning something new, and every day I still feel like a new grad in the NICU because there's so much to learn, so many different disease processes. And so I'm constantly looking stuff up, using like physician manuals, like looking new disease processes, new medications. And so if you start getting comfortable, these are things that you start doing less and less, which is something that is not going to be in the best interest for your patients. So never get too comfortable. Another mistake that I see nurses make is trusting the previous nurse's assessment. Nothing against other nurses, but a healthy habit to make is not to trust the assessment of your previous nurse. A nurse might say, oh, I checked the skin breakdown on their bottom. It looks fine. They're good. Do not go throughout your shift just trusting the word of that nurse and not checking skin breakdown because, oh, the previous nurse said it looks good, so I don't need to check. Listen, there are some people that sometimes just say things just to say it because, you know, they might have not done the assessment and they don't want to look incompetent and they just want to make it seem like they did more than they did. And next thing you know, you go look at that patient's bottom and the skin is completely gone. So that's just a small example, but always do your own assessment. Don't go off the assessment on the of the previous nurse. Another mistake that nurses make is not reading clinical notes. Again, this ties into trusting the assessment or the word of the nurse prior, especially if you're night shift. A lot of times you don't participate in like inpatient rounds. You don't really get to hear the plan of care from the doctors. And so you really have to go off of what the nurse tells you, or you can take it one step further and do your own research and read your clinical notes. Those are the best resources to give you insight onto what's going on with your patient. Ooh, y'all are not gonna like me for this one, but please scan your medications. Oh my gosh. I see this a lot in nurses that are comfortable and have been on the unit for a while, especially the ER. A lot of times our medications aren't even in the MAR for us to be able to scan, because a lot of times it happens so quick. But y'all, if your medication is in that MAR, just scan your medication, okay? It's gonna save you a lot of headaches. It's going to save you a lot of bad patient outcomes, because as much as we think we are proficient and we know everything and we're just perfect and the best nurses ever, all it takes is you not double checking the medication and just giving it to a patient, and boom, wrong medication given, and that's a whole can of worms you do not want to open. So if you're not scanning your medication for any reason, if the system's down, you're not able to scan, the barcode doesn't work, make sure you're double and triple checking that medication, because again, just don't do it. Medication errors is a problem that you do not want. Another common mistake is not asking for help, y'all. Oh my gosh. And I get this, because sometimes you can work with people that make you feel like they're unfriendly, do not create a warm, welcome environment for you, and you're almost too timid to ask for help or don't want to seem incompetent. Who cares? Ask for help. The priority is your patient. If you were not sure about something, you've asked this before and you don't remember what the answer was, who cares? Ask for help. You are never wrong to ask for help, but you are wrong to do something without knowing either why you're doing it or how to do it. Ooh, another huge tip that I can give you guys, a mistake that a lot of people make, is, I know we heard this all the time in nursing school, but it is so true. If it's not charted, it didn't happen. So a lot of times people forget to chart things, or we'll leave things out. And if someone is auditing your chart, listen, if it's not in that chart, it didn't happen. So if you gave a bath, if you turned a patient, if you gave a medication, if you gave a treatment, if you did wound care, if it's not charted, it didn't happen. God forbid that case goes to court, whatever happens, even if you get audited on the unit, whatever. If it's not in that chart, it didn't happen. I don't care what you told your pod mate. I don't care what you told your neighbor. I don't care what you told the nurse down the hallway, what you did. If it's not in that patient's chart, it didn't happen. So please, please, please chart everything that you do. Chart who you speak to, chart what the doctor says, chart the orders you received, write it in the chart. And the last tip I'm gonna give you guys, a mistake that a lot of nurses make is not reporting a change in a patient's condition. Now, this is something that is not always obvious, and a lot of times you may question yourself, is this something that I need to report? Is this a change from baseline? I'm not 100% sure. If you are on the fence, report it, because the last thing you want is the patient starts declining and no one alerted the NP, the physician, the PA, and now this patient has negative patient outcomes because something was not caught in a timely fashion. It doesn't hurt to just have a practitioner or a provider come look at it quickly, whether they give you peace of mind or whether they put in more orders and make a change to the patient's care. You did your job. Report changes in patient condition. Well, that is the end of my video. Thank you guys so much for watching. If you have any other tips or know of any other common mistakes nurses make that you can help shed some light on, leave it down below. Thank you guys for watching. We'll see you next week.